Welcome to Micro Health Talks, where we bring you insightful discussion on all things that is health and wellness. Joining with us today is Dr. Junaid Kalia, all the way from Texas. Dr. Junaid Kalia is he's a pioneer in neurocritical care and also driving AI in healthcare. Doctor, welcome. Welcome to Micro Health Talks, welcome to Micro Health Laboratories, and welcome to Qatar.
Absolutely. It was an amazing, fun time to actually see Qatar and specifically micro health laboratories, where essentially it is a reference lab with next generation sequencing.
Yes.
And it's amazing that you're actually combining both the next generation of labs with radiology as well, where you have CAT scans, ultrasounds, and MRI. Not to mention, it is powerful for a patient to come in at one location, get all the services they need. But as we move forward in data analytics and data standardization, normalization, we can bring better artificial intelligence with different sources of data.
Certainly. So, Doctor, like to start with, they say innovation is to be seen as an opportunity, but not as a threat. So, how do you comment on this?
So, throughout history, innovation is essentially a tool. I mean, when we discovered fire, it kept us warm, but we burned each other too.
True.
Nuclear energy is one of the most safest, more powerful, and easy form of energy. However, there are some consequences.
Certainly.
I look at any innovation in terms of technology, let it be fire, electricity, nuclear, and artificial intelligence at this point in time, which is truly, in my mind, one of the most remarkable piece of technology we're working with. Think of it as a tool. And it is up to us to use any tool for betterment, for productivity. And in some cases, unfortunately, some people will maliciously abuse it too.
So, you are trying to say that it's all about how well we make use of the tool.
As always, the most important thing in terms of technology has always been to make sure that the assessment, the way that we deploy it, how we put guardrails around it to produce both safety, security, and more importantly, important use cases like medicine,
Certainly.
Driving genomics forward, drug discovery forward. I'm going to concentrate on AI in healthcare, but of course, AI as a whole topic is amazing to bring a lot of productivity to human beings.
Doctor, can you define your journey from neurocritical care to AI?
Okay, it's very interesting actually. So I'm a neurocritical care stroke and epilepsy specialist. Working as mainly an in-house neurocritical care physician, and then of course did telestroke. And then once we were doing telestroke, we realized the power of artificial intelligence to quickly give us assessments on CT brain images. And the decision process, the value proposition for us was very simple. Either can be a blocking type of a stroke or a bleeding type. And we needed that information fast. And we need that information. When I say fast, we want ultra fast.
Okay.
The reason what ultra fast means is that every 1 second, 32,000 neurons die. Yes, that's a huge thing.
Yes.
So if I lose 5 minutes within that care, you're losing a limb or an arm or a limb. So you have significant disability. So there were, again, applications in the United States that were helping us do that. And we wanted to make sure that this is more accessible globally. So we initially developed it as a project for making it free and still, free for low and middle income countries. But then we realized that we have so much more potential. So we got FDA approvals and then turned it into a company so that it will be a sustainable effort and not just one project. So then we find very high impact projects. So for example, on chest X-ray, we're doing TB diagnosis or pneumonia diagnosis. If you give medication even 3 hours early, you save an ICU admission 1 in 20 chances. You save death in 1 in 40 chances. So we concentrate on narrow spectrum AI, which have high impact consequences, both in terms of patient lives and, disability. But of course, it is important for ministry level, public health level to understand where to apply it properly
and then to implement. So, according to your statistics, you say that the rate that you can save life has increased on a rate, like after with the implementation of AI?
Let me give you the whole picture. For example, if it's not a bleeding type of so CAT scan gets, a person comes with a stroke, you just put it on a CAT scan that uploads to my software. And the idea is if it's a bleeding type or a blocking type. So the blocking type, we have one powerful blood thinner that is also called the clot buster. TPA or TNK is their technical terms. But if it is a blocking type, you give that, if it opens up and it also continues to improve, patients' modified Rankin score, which is we call disability score for up to 90 days.
Okay.
So what is the issue? The issue is that if we don't give this medication, if we slowly give this medication, we are, as insurance and payers, are paying for a long-term disability, which can cost somewhere between $100,000 to $500,000. So if you use this software just to improve overall, let's say even 10 patients by 1 minute, you have saved $100,000 right then and there. So that is where, when you say that ultra fast implementation is considered, that is why it is so important to know. Going back to your question again, that how we deploy these solutions, again, I think that healthcare is to be the most important use case scenario for artificial intelligence. Simultaneously, it is the hardest to make sure that it's implemented correctly.
Rightly, yes.
So unfortunately, we cannot, chat GPT like make it available for everyone.
Okay. So doctor, speaking about the implementation, yes, we understand with developed countries, implementation is easy and accessible. But how do you think it is going to be for developing countries?
So first of all, people have to understand, most importantly, that we are seeing significant progress, especially in countries like India, Bangladesh, Pakistan less so, but at the end of the day, we are seeing what we call digital radiology revolution. So we have gone from those white boxes that were hanging and people were taking off these. So first of all, most of the radiology globally now is going to what we call digital radiology.
Okay, so there is a revolution already happening.
This digital radiology is happening, period, everywhere. Now, we need to find the right way to deploy the solutions in that particular environment. So at least in Neurocare AI, what we have done is that we provide solutions at the edge. Literally at edge means that you can, the chest X-ray machine or a mammography machine, you can put the actual AI embedded into that machine itself. So therefore, the overall value proposition, how the physician get access to the images, how when they're reporting it, they also look at the AI read, gets seamlessly integrated. But as far as implementation in US is concerned, it's fairly different. You have to sometimes put it on PAC servers. You have to make sure that it is available through on-premise or sometimes on cloud. So number one, I think that's a fairly, that used to be that digital radiology was not the norm. I believe, and actually I know now, that digital radiology is the norm. And within that implementation, you can put AI anywhere, depending on the situation.
The requirement and the situation, it blends hand in hand.
Correct. So some hospitals, some physicians would prefer at the level of the PAC, some would prefer at the level of DICOM, some would prefer at the edge. It doesn't matter. As long as it's digital radiology, you can implement it.
Okay. So doctor, what do you comment towards the resistance that you see among the people to accept when it comes to AI, like AI in healthcare? The first question that goes to people's mind is, what are the ethical values? So there is a strong concern among the common public about these ethical values with integration of AI. So how do you like to comment on that?
So first, always understand the historical context as well. Now, I understand that everyone's talking about AI, but if you look at Times Magazine or New York Times and just search, is Google your doctor?
Certainly.
So literally 5 years ago, my patients would come in and tell me, oh, Google told me that.
Yes.
So now they're coming and saying, ChatGPT told me that. So it's not really changed human behavior as per se. The difference is that the artificial intelligence, when it communicates, believe it or not, it communicates with better empathy than I do. So there are studies that double that.
You mean to say the AI is more empathetic than you?
It communicates better.
Okay.
The way that the NLP processing works is that the way that it communicates is sometimes with higher confidence and with
Statistics?
more empathy. Yeah, we have stats to
Yes.
prove that.
Yes.
So when I speak to the patient, I mean, of course, we're seeing like 20 patients a day. We have like surgeries and all of that. So patients, believe it or not, feel like I'm more disconnected than ChatGPT. So that's an insane problem that we have to solve right now. But at the end of the day, this has not a new problem. This has been the same problem which was the Google as a doctor,
Yes.
and now ChatGPT as a
Yes.
doctor. Now, what we physicians, how we use AI is extremely different at what public generalization is. We have a very generally, right now at least, we have a very narrow focus of AI. We implement it in disease diagnosis and detection, and those are essentially for example, my solution, it has to be FDA approved.
Yes.
And that FDA approved is like literally what we call software as medical device, and then only we can implement.
True.
And believe it or not, FDA took so much closer look at everything. They first of all, they have this post-market surveillance, cybersecurity, implementation, software guidelines, change management, all of this, and then more so importantly, clinical. So even if I have to prove for my FDA, I had to prove that it works on male and females. I had to prove that it works on multiple slice sections. I had to prove that it works on different bleed types. Then I had to prove that it works on different imaging modalities, imaging manufacturers like Siemens, Philips, etc. So believe it or not, we have to prove a lot when as a company to FDA before it can be implemented in real life. That is this. Now, of course, there are pathways that FDA is not ready or has not done. So, for example, these large language models that we're talking about,
Yes.
generative AI, and the value proposition over there is mainly from clinical documentation itself. It can provide suggestions. For example, I wrote everything and then I said amoxicillin 500 milligrams in the note. The benefit that comes in is that, oh, by the way, this patient is actually allergic to penicillin. And if AI recommends it, great.
Yes.
It saves my life, right?
If it
And the
doesn't,
patient, if it doesn't, it never used to. So what I'm saying is that pathway of large language models, believe it or not, it is always, if implemented right now, is suggestion based. I have to accept or unaccept. It's same like you are getting Instagram stories that are recommendations or YouTube videos that are recommendations. They are never decisions. So they're always what we suggest, and that's the word that the industry uses as a co-pilot.
Yeah.
So we are always in the controlling seat, not AI.
Okay.
Yeah.
So you mean to say at the end of the day, the control is in our hands?
The control is currently in the physician's hand. This may change at some point in time in some narrow focus, which is fine too, because when you have at places, you can implement it as well. I mean, this is a bad example. I'm going to go ahead and give it to you. So for example, people always talk about AI and warfare, because those are, believe me, the word, when you use high stakes AI, there are two areas, healthcare and military. Okay. So when you distinguish it, so we study military ethical AI as well, because we want to know if we are doing implementations, because they come up with, significant guidelines. Everyone thought that, oh, the person, a human being, should push a button for the missile launch, right?
Yes. That's what you see in the movies.
That's what you see.
Yeah.
But that was actually, if you really look at the whole workflow, that is just completely stupid.
Okay.
Because in the last 5 minutes, the drone is already jammed, it's flying on its own.
Yes.
The human being is really done is that when the whole AI has looked at the surveillance of the whole area, topography maps, everything, and then look at, different intelligence reports and everything, and combined it. And then the analyst and the computer has actually said, okay, this is the area we're going to concentrate.
Okay.
That is where you push the button,
Precisely.
not at the missile one. Do you understand? So what I'm saying?
Yes.
So you have to understand where the decision is actually made and where the human needs to be involved. So this is called human AI interaction. Sometimes it's called human in loop.
Okay.
So both of these situations are extremely important in high stakes AI, which is medicine and military. And then and then the idea is to where the human needs to be present. And we like essentially to understand, everyone should understand that, believe it or not, human is not needs to be involved at the end port. It's actually the starting one.
I mean, with regard to the decisions.
Correct.
Mhm.
So, for example, in health, in medicine, we can say, right, if you're building a program for breast mammography imaging screening program,
Mhm.
yeah. So that is the decision we made at the level that we are going to
Okay.
deploy AI at millions of people, let's say in Sudan or in India. That is where the decision is.
Yes.
The decision is not, okay, we're going to put it at X hospital. Do you understand what I'm trying to say?
We get it,
So, and then you decide what level of sensitivity, specificity you need to tinker with the whole screening program, etc.
Okay.
So, when you are deploying AI, that is actually what we call semi-autonomous. That is more of a decision from the beginning. But
Okay.
when you sit as a physician on the table treating the patient, these are all suggestions. These are not decisions.
Okay, that's a lot to comprehend. So let me put it in simple. You mean to say AI? It's all about with a touch of human.
Currently,
Okay.
it's always, especially in healthcare, it is still that ethically applied. I don't know what people do.
Okay.
At least in US, FDA approved products with significant testing is applied.
So provided it is ethically applied, it's with a touch of human.
So that's not so. Ethically, there's always a touch of human. I developed AI, right? I'm a human, so AI didn't develop AI. So what you're saying is that the decision for application of artificial intelligence at the level it is implemented in the course of the patient journey is always decided by human.
Okay.
And if it is at the end table, like you're a patient or I'm a patient,
Okay,
it's
okay.
always co-pilot, suggestion, recommendation. It is never in the driver's seat at the moment.
Okay. Okay. So you mean to say at the moment, stressing on the back, and also you mentioned currently, what is in future?
So it's very hard to predict future because it's extremely fast growing field. Just to give you an example, ChatGPT was like what, year and a half, 2 old, and then we have Claude, Gemini, and of course DeepSeek.
DeepSeek, yeah, DeepSeek is a dot
Correct.
now. Yeah.
So again, when we are looking at the future, it's very hard to predict. I believe still that in the next 3 years, we will have massive exponential implementation of healthcare, which will provide us with the data in which we can then decide where places AI can be truly autonomous.
Autonomous?
Yeah, truly autonomous. There will be limited times where people can be truly autonomous. Just to give you an example, like for example, chest X-ray machines coming, and then there are people who are gonna, let's say, work for cruise industry, and the employees are coming in, and they need to get a chest X-ray done to make sure they didn't get exposed to TB. I mean, if they got it,
Yeah.
it's you get the pills for 4 weeks, etc. It's not a big deal. So that decision cycle, given that the risk of overall management is lower, can be maybe autonomized. Not right now, maybe possibly autonomized
In the future.
in the future. But again, these will be very slow, narrow selection things where you can do what we call 100% autonomy in very small solutions. But by the way, we do have autonomy, and those are like backend, like insurance claims, processing, etc. They're doing autonomously. So there are places in the backend process, not
But not-
clinical artificial intelligence, clinical level, that they're autonomous.
Okay, so how long it would take to see the drastic change which you're looking forward to see in the field of AI?
Right. So I was at JP Morgan Health Conference in San Francisco, which is one of the largest conferences of industry leaders, influencers,
Yeah.
CIOs, CTOs, of large hospital systems in US. Also, there's a strong presence from NHS, UK, etc. The sentiment from last year to this year is completely changed.
In terms of?
In terms of last year, it was interesting.
Okay.
Wow, that's fantastic. But this year, tell me, Junaid, how do I implement it?
Okay. Oh,
So that is the difference, that when we were talking to industry leaders, the whole sentiment has changed. They actually do tell us that they now have officially for 2025 have budgeted number of dollars in their IT stack specifically for AI.
So you mean to say a year has changed a lot and we are already in the path of revolution?
So a year has changed what we call direct implementation. It is no longer a dream. It is now a pipeline.
Implementation.
Now you're asking like how many years will it take for fully mature and then implement? I think within 2.5 to 3 years, you're going to see massive implementation, or especially in US. And also, I believe in some places globally will be even faster than US. And that will change the way we practice medicine in terms of efficiency and in terms of, using
care.
machines. Patient.
Okay. So
Huge difference.
yeah. So we are already in the phase of revolution. And
Oh yeah, we are. This year, 2025, is the year
okay.
to see real implementation.
AI revolution.
And not just the hype.
Okay.
Yeah.
Yeah. So, Doctor, like, be a pioneer in this revolution. And what is the one message that you would love to give to the society?
So
To AI and healthcare, and considering the ethical values which people are concerned about AI and being in the pathway, like reaching the milestone in the revolution. What is that one message?
One message. Very. So for physicians, it's very simple. Physicians that use AI will be replaced by physicians that do not use AI.
Okay.
For the general public to understand that that at the end of the day, we have had these tools for a while, right? I mean, if you look at your simple lab report, 1.7 hemoglobin or whatever, there's a normal values already attached to it. We always had number of tools to take care of our lovely patients. This is just one of the tools that we will use now more often.
Okay.
So it's not a scary thing. It's not something that, physician is, off sleeping on the wheel.
Okay.
He is driving the car.
Okay.
It's just that there's some, he's able to auto park. He's able to do many things,
Okay. So, Doctor, like, there is one more question which generally the common public or the people are always, like a little scared of. Is AI going to replace human? Is AI going to replace the human resource?
So the question always is very interesting. I don't know if you remember those days when there were telephone switchers. They used to take
Yes,
out one
we do.
point and then put it on another.
We 90s kids, we do remember, yeah.
Yeah, I mean, at least I remember. I'm showing my age now.
Okay.
So at the end of the day, what you're seeing is that there are things that humans used to do. Believe it or not, AT&T, which is basically born in Dallas, they have so many switchers that at that point in time, they predicted that all of America has to do switching
Okay.
to actually be able to just do the work demand.
Okay.
There's, of course, zero telephone operator switchers anymore, right? So technology curve always brings changes, and this scarcity has always been in the mind. What we have seen from past experience, at least, is that technology not only brought better, higher quality jobs, but also physicians, not just physicians, all human beings have a higher quality of life. Everyone has a refrigerator now. Everyone has. Do you understand? So generally, this is the case. Now, AI, however, is a little different. It is a little scary. We will need a constant, what we call, if we were manufacturing, for example, retooling to put AI in the machines, and humans, we're going to have re-education needed. But overall, I think the job market, we will find jobs.
We will find jobs.
Yes. And
you mean to say the jobs are secure still?
It's the job nature of job will change.
Okay. Unless and until you're updated with the AI, do you mean to say that as well?
Even though if you're direct in competition, I'm just going to be very honest. Like, for example, if you're going to do this, we have essential, powerful AI video editors for this, right? But I know that I'm not going to be able to replace the team here. We need it. So maybe out of the 3 people, you need 2 people or 1 people. But at the end of the day, I will still need a human being.
Yes.
At the end, even though it is fully automated and does perfectly. So I still do not think that it can replace all humans. Yes. So the leaders say that one of 5 people will be replaced and will be new to do new education, which is again important. We need physical education. We need speech therapists. We need so many people jobs. We have so many demand even in healthcare that needs the human touch. So some of these shapes will change.
As you told, like 1 of 5 will be replaced. Be that one who is not to be replaced. Be that one who is updated.
And most importantly, as a life lesson, always keep learning.
Always keep thinking. Learning is a like continuous process. Like
And honestly, if you look at it, again, we forget like 50 years ago, the average lifespan was 50 years or less. Now we're living at 80 years.
certain.
People have 2, 3 careers in life. So what? Right? I mean, I am actually, started as a physician and now I'm running a startup. And who knows, 10 years later, I'll be doing something else.
Where would that take you?
So the lifespans that we are having, the way we are living, we are going to have a 2, 3 careers in our life. And I think that's, in my opinion, awesome, right? So,
I agree with you.
so,
Yes.
so it depends. The value proposition is in AI is there. You will enjoy not doing repetitive, crappy tasks. Your quality of life will improve, but you have to learn better.
You have to learn better.
That's
yes.
keep learning.
So how better you learn and how better you stand in the race, all that matters too.
Exactly.
Certainly. So, doctor, thank you very much because you tap the areas which always remain like a taboo to people, which were like a frightened matter, which were always a matter of resistance to the public. So, you tap those areas. Thank you very much for that.
I'm extremely grateful for MicroHealth team and putting this podcast together and educating everyone.
Pleasure,
Thank you
pleasure.
so
Thank
much.
you for having me.
Yeah, thank you so
So,
much.
to conclude with the same note that we started, innovation is never a threat. Innovation is a change which is to be considered as an opportunity. Let's grab this opportunity, as Dr. rightly said. Let's never stop learning. Let's be the one who leads. Thank you. Signing off, Micro Health Talks for Precious Life.